C, right? And so that's always the first body system that any books on A&P will take up. So there is your skin because it's a body system. What are the organs that belong to your integumentary system? You have your skin, which is also called integument, your skin. You also have your hair, your nails, your glands. This are part of your integumentary system. You also find muscle there. So that's why two or more organs make up a tissue. Two or more tissues will make up an organ. So the skin is both part of your integumentary system and it's an organ. And I know you have blood supply there and then there's nerves. So there's nervous tissue. So that's why you define it as an organ. You should know this term. Dermatology is the study of problems with your integumentary system. So before we look at the anatomy, what does the integumentary system as a whole do for us? Of course, we know this part, right? It covers and it protects. So it covers everything, everything. The skin, the intact skin, they say is your single most important defense or protection against, especially your bacteria. You always have enemy forces, so you always have. This is your best defense. It also protects us from, so if these are pathogens, the bacteria, from injury, UV rays, right? We know that the sun can damage us, and so healthy skin is very important. We're going to look at the anatomy, the different layers that helps in protection against UV damage. You know that you get your vitamin D from the sun, right? They say go under, and it's not enough to stand right there where Jackie is standing. It's not enough to do that one because the UV rays that's important for vitamin D production is blocked by any kind of barrier right there. So that's why a lot of old people, you notice when in the nursing homes, when they're in a wheelchair, they depend so much on their caregivers to take them out. And if they're not taken out, they may suffer from vitamin D deficiency. It's not enough to be standing or sitting next to the window. Then they get so cold. They go outside, but they bundle themselves, so they still don't get their vitamin D. Write down in your notes. Do you remember where you get vitamin D? What is the compound that is converted to vitamin D? It is your fat, which is what are the three types of fat? Cholesterol. So cholesterol is the one. So you see how important cholesterol is? So when you go to under the sun, the cholesterol under the skin is converted to vitamin D. So does it make sense? If we're lacking fat in our diet, maybe you'll have ugly skin. Ugly is not a nice word, but you know it will show in your skin because you need your cholesterol. Okay, you understand? Besides, why do we need vitamin D? It is for absorption of calcium. Very good. You cannot absorb calcium in your diet if there is no vitamin D. Okay? They go hand in hand. Even if you're taking a lot of calcium, if there's no vitamin D, you cannot absorb it. It's just a waste of money. Okay? And that's why, and calcium is for strong bones. So you see the consequence? If we're lacking in vitamin D, we may have problems with bones. So people will, I know you've heard of vitamin D deficiency syndrome, where patients deficient in vitamin D, they will complain of bone muscle aches, bone pains. They say bone tired, which makes sense because when you move, you're actually moving your bones. And so it's just painful to move. They're depressed. Depression is another symptom or sign of vitamin D deficiency. They have toothache because the teeth, they're supposed to be anchored in your bone. And so if there's not enough vitamin D, just always think not enough vitamin D means not enough calcium. They just go hand in hand. Okay? Okay. We know this one. Does it make sense? Your skin is important for thermoregulation. We know that, right? We sweat through our skin. Then when we're cold, we have the goosebumps. So they are able to regulate your normal body temperature. Okay? Do you know that it is also important for getting rid of waste? You remember we talked about urea from what? Breakdown of what? Proteins, remember? So proteins, when you break down your proteins, remember that the ammonia, because we're humans, we cannot process ammonia. We cannot metabolize that to our advantage. So what happens to that ammonia? We have to get rid of that. There's two ways to get rid of that. Your kidneys and sweating. So, like I said, if you eat too much protein, you notice that you will sweat more compared to those who maybe are vegetarians, they don't eat too much protein, then they don't sweat as much. This is toxic if it stays in the body, so you have to get rid of it. You sweat it out, you pee it out. It's out. Okay? So that's a job of your integumentary system. Okay? Then it, you know this, it reduces water loss, you know that, right? But don't forget, I always say that it is not completely resistant to water loss. Eventually, like if you're stranded in the ocean, or you know that you lay down in the bathtub, after a while, you get up, your skin gets wrinkled. So that's proof that even though it helps to reduce it, it is not completely resistant. So you still have to do your job to make sure that you have healthy integumentary system. I know you understand this, right? It must, it's impossible to have no sensation here. If God made our skin to be without any nerves, or no, integumentary system to be without any nerves, then I can cut you up. You're not going to feel anything, right? So you're gonna die. So that's why we have that. Now we're ready to look at the anatomy of our integumentary system. The first, we're going to look at the integument. So we're just looking at, again, did we talk about the structures that make up the integumentary system? We talked about the skin, right? Then you have your hair, your nails, and your glands. We will talk about now the major part of your integumentary system, which is the skin. The skin is also called integument. See? Because it's the main organ of the integumentary system. That's why you call it integumentary system. And if we look at this, you look at your very nice pictures in that lab manual, very, very nice pictures. If you look at your integument, okay, you will see that there are two parts to your integument. The superficial part is epidermis right here, and the deeper part is dermis. If you look at your textbook, there is an even deeper part called hypodermis. You see that? Figure 5.1. But don't forget, it says there in your book, the hypodermis is not part of the skin. There's always like a true or false statement where the skin is made up of epidermis, dermis, and hypodermis. Maybe in your final exam, you're going to mark true. That's false. The hypodermis, that's not part of your integument. So the job of this hypodermis, which is also called your subcutaneous layer right here, the job of this one is to anchor your skin so it doesn't fall off by gravity. It's like your glue. It pastes your skin to your body. You understand? Is this part of the skin? No, it's not. Okay? So I want to look at these two parts. So what do you think? Just by looking at this one, what is the tissue type of your epidermis? Is it the fourth? That's very good. It's epithelium. I know it's epithelium because there's a free space. Remember, epithelium is the tissue type you see. So anything, I see this one, this must be epithelium. I see you open your mouth, what I see is always epithelium. You understand? So I'm going to look at this epidermis. What do you think? Is it simple or stratified? Stratified. I see it's many layers of cells. See? Many layers of cells. You have slides of the skin over there. Many layers of cells. So it's not just one layer. It is stratified. You understand? This is the epidermis. I see it's epithelium. The dermis, look at the dermis. The dermis is connective tissue, isn't it? You see the difference between the two? Now we're going to look at the epidermis, okay? Let's look at this epidermis. It is a stratified and the topmost is flat. So it is stratified what? Yes, very good. So the epidermis is stratified squamous epithelium because the topmost is flat. You remember that is if it's more than one layer, it's already stratified. And the name of the tissue always takes after what is the topmost. If this was columnar, so I would say stratified columnar, right? If this was cuboidal, I would say stratified cuboidal. But because the top is flat, stratified squamous epithelium. Let's look at the stratified squamous epithelium. This is your epidermis. So here. Look at this. Okay? Look at many layers. So these are all stratified squamous epithelium cells, okay? And they have a name. Most of the cells of your epidermis, most of them, what they do is they make keratin. So that's why they're called keratinocytes, you understand? So my epidermis is a stratified squamous type of epithelium. Most of the cells that make up my epidermis are called keratinocytes. Why? Because they make keratin. What is keratin? Is it carbs, proteins, or fat?
Protein.
Very good. Protein synthesis. You see? They're busy making proteins. What is one characteristic of epithelium? Do you remember avascular? Right? Do you remember that?
Yes,
Epithelium has no blood supply of its own. So I want you to look at this epithelium. Look at this, okay? Right down here. Very nice. I see the pretty nucleus. Did you notice something? As it goes up, what do you notice? Do you still see nucleus here? No more, right? So here, by the way, look at this epithelium. Is the layers of cells are grouped into stratum. If this was going to be asked, I'm going to label it for you already. What I want you to know is to analyze what's going on. So you make a story in your head. Look at the stratum basale, which is the deeper layer. Compare this with this. This living, yes, because it's close to the blood supply. Look at the pretty nucleus. This dead. Okay? Why? It's so far from blood supply. So look at nice nucleus. By the time you get there, dead. I'm looking at this one. They're very much alive. What's going on? Protein synthesis. They're making keratin. So, but by the time they get to this stratum granulosum, this in fact is referred to as the transitional layer. They start dying off because they're so far from the blood supply. But even if they start dying off, what's left inside every keratinocyte are the keratin proteins. What's the function of keratin?
Protection.
Correct. Protection. It's a tough protein. So that's the one that helps us with water resistance. Okay? And also for thermoregulation, just tough protection, right? I can scratch and scratch and scratch. It's still healthy, my epidermis. Do you understand? Okay? But one more thing, right here is the stratum granulosum. That's what it's called, granulosum. They start accumulating oil, lamellar granules, it's called. Too much for you to learn and to remember, I mean. So just picture in your head, oh, they're making keratin here by protein synthesis, ribosome, RER, what else? Golgi body, you see? Okay? Oh, that's why, right? We have to really pay attention to our diet. Do you agree? If I'm lacking in protein, it will show in my skin, right? Because I need it. to make my healthy epidermis. By the time they get here, they're dying. At the same time, they have that oily plug called lamellar granules. So can you imagine? So they're like glued together, but by that oil plus that keratin, by the time they rise up here to the top, very tough and protective. Do you understand? Can you picture that? Okay? Okay. One thing I want you to understand is appreciate the many layers of your epidermis. Okay, look at all of that many layers. Here, what do you think? High cell division or low cell division? High, right? Here, no more cell division. Here, high. So this is the basal layer. I know there's high cell division here because it is very close to blood supply. A part of metabolism is it's able to divide. So they're constantly replacing the cells that I lose here. I lose the cells here because they're dead. Okay? So eventually they shed. And when you walk by sometimes you see some dust particles. Where did that come from? From you. That's from you, right? Your skin sheds. It doesn't just not just one cell layer. It always sheds in sheets because of that oil plugs. You understand? And when it sheds, we have to always clean or vacuum. Why? Because that's food for your dust mites. You understand, right? That's why if not, you will always maybe have problems with allergy. You're encouraging the bacteria to grow in your carpet or wherever because it's just made up of organic and inorganic compounds. And that's food for them. You see, it's like manna from heaven for them. So we have to constantly clean. That's why you understand, okay? So now I want to look at these many layers. Do you know that we're just studying how we were made, right? I'm thinking to myself, there must be a reason why God made my layers of epidermis this many. You know that there's 25 to 35 layers of stratum corneum, and here another 15 to 20. And you go deep down that, there's all of these layers. Just think, look at
Radiation.
very good. What's under this one are your internal organs, right? So I have under my muscle alone, right? Your muscle, we know that so under my skin, I have my muscle, right? What does muscle do? It contracts so we can move, right? Then under muscle, you have all your internal organs. They're doing something. Your heart is beating. Everything. They're doing something in there. So everything in there is prone to UV damage. You understand? Right? So that's why we have those many layers. There's a reason for that. And the reason why I talk about that is now it will make sense when people go for that, what is the skin peeling or dermabrasion?
Yeah,
Don't they
microdermabrasion.
advise be sure to apply sunscreen? You see, look at people who do that skin peeling. They peel their protection because we want to look pretty for our husbands, maybe, I don't know. So we peel that one. Look at your protection is compromised. And then I'm just going to go out for 15 minutes. Then 15 minutes became 30 minutes, became 1 hour. What do you think? You're more prone to UV damage, you see? And that's why we worry about that. Or if you have the sunburn, right? If you have sunburn, and the kids, they just don't, they will say, you're baloney. Nothing happened to me. Nothing happened to me. That's the thing about all these things we're studying. You wish that the effect will be immediate, right? So we learn our lesson. But it's not an immediate effect. It will be many years from now. And then you're scared. You get the diagnosis of cancer. You see? It's just a matter of appreciating how you were made. You always think there is a reason why God made it like that. You see? So, but anyway, if we do the skin peeling, just know that you take away most of the protection, UV rays, very easy now to penetrate. And it's not only this one, maybe deeper tissues. And down here in the dermis is where blood is. We're going to talk about the different types of skin cancer, but you understand so far? Okay? Yes.
I just have a question regarding tattoos. So when you get tattoos, if your skin is always shedding, why does the color
We're going to
stay?
talk about that in a minute.
Quite deeper than the.
Very good answer. Very good. There's two parts to the skin, right? The epidermis and the dermis. So if you get tattoos and it doesn't shed, it stays there, it must not be deposited in the epidermis. Where was the tattoo deposited? It must be deeper in the dermis. That's all. Okay? Remember that there's two parts to your skin. Yes?
I understand it's deeper than the superficial layer, but that still doesn't explain to me
Right
why.
here. There's
Is
your
that why
dermis.
it bleeds? Is because
Does
it's
this
metabolism?
Does the connective tissue shed?
No. So that's
No.
why it's in there.
Yeah. Right? This one sheds. This one doesn't. So this is where tattoo is deposited. Okay? Okay. So now let's look at the other cells of your epidermis. Look at, in addition to keratinocytes, the most, again, I'm going to say that my epidermis is made up of stratified squamous epithelium. Most of them are called keratinocytes. You know what it does? There's other cells that make up my epidermis. The next one I want to study, melanocytes. What do melanocytes do? They what? They make melanin. Very good. What is melanin?
Protection.
Yes, but what is the composition? Is it carb, protein, or fat? Again, it is protein again. Protein synthesis. You see, that's why we have to study protein synthesis. You see now? The bulk of the life cycle of cells is spent making proteins. That's why protein synthesis is always the first few chapters of any book on A&P. So look at this one. So what do you need to make your melanin? Amino acids again. Okay? So this and I want you to pay attention to the anatomy of the melanocytes. Look at the shape. Compare this to your keratinocytes. Very nice. You see the difference? This one, cuboid, you see that? This one looks like an octopus. Okay? So look at. So your melanocytes make melanin. That's its job. Okay? And you said that melanin is for what?
Protection.
Protection against UV damage. Okay? So, but the melanocytes will unload or release the melanin that it made to the rest of the keratinocytes. What is that process where cells release substances out? Very good. Exocytosis. Very good. If I ask you in the test, don't panic, okay? You just write exocytosis. It's called cytokine excretion, but the general term is exocytosis. And then when they absorb, what do you call it? What are you going to write? Endo. So don't panic, okay? Just simple terms. I just want to know that you understand your A and B. So that all your keratinocytes, that's how they get covered with melanin. Melanin is stored in, do you remember? Inclusion bodies. You remember that? So in your test, right, if I have a picture of the cell and it's pointing and I say contains pigment or contains fat, what is that organelle? It's called inclusion body. And the function is for storage. That's where your melanin pigments are stored, or that's where your fat is stored. Okay? And so that's how all of the keratinocytes end up with melanin. We all have the same number of melanocytes, by the way, right? It's just the amount of melanin that my melanocytes make that makes me darker than you. Okay? But we all have the same number. Okay? So, as they secrete or release the melanin to the rest of the keratinocytes, note where the melanin is concentrated. It's concentrating around the nucleus of every keratinocyte, because the nucleus is the one that houses our chromosomes, right? Your DNA, and that's the one we don't want that to mutate. And then once it mutates, it may start forming a different type of cell cancer. Speaking of cancer, you know that there are three types of skin cancer, the basal cell carcinoma. So now look at this. What is that? Basal cell, then squamous cell. Now that you know these layers, you see stratum basale, and then these are all squamous cells. So the basal cell and the squamous cell carcinoma, they're just carcinoma affecting the keratinocytes. Does it make sense? Right here, the squamous epithelium, you understand? So, and their shape, again, look at their shape. Now, we compare those two types of cancer, which is not as bad as if compared compared to melanoma. Now I'm gonna look at this melanocytes. Look at this one. Look at this. The melanocytes, by the way, are in the deeper part of the epidermis. Makes sense because they're also alive, right? It's impossible to see the melanocytes in the top part because the top part is dead. You agree? So they're mostly in the deeper part of the epidermis. Okay, you follow? Okay, so they're there. Then again, we talk about our skin peeling. So you peel this part right here. You see them, right? The dermabrasion, the very, very red skin, and they're so prone. Look at when the UV rays strike this, and they end up being cancer. The reason why melanoma is so invasive is you look at the tentacles, right? It doesn't only go up right there to the epidermis, but it goes down. And if you look at the dermis, so it will start invading the dermis. And if we look at our dermis right here, so the melanocytes are here, right? And when they start becoming melanoma, they start doing their octopus processes. I'm just using the word octopus. The processes down here. Look at what's this one, red and blue. What's that? Blood vessels. So it's quick to spread. You see that? Right? So that's why, you know, I guess it's not bad to go for dermabrasion. They advise it, I guess, to be pretty. But just remember to apply your sunscreen because you are exposing. That's the thing. There is a reason why we have all of those layers. All of those layers, that's your effective UV protection. When you peel away those layers, now the effective UV protection is compromised. And so now you are having the danger of even affecting, causing mutation to your melanocytes, which is really
So I have a question.
very scary. Yes.
So what's happening like when people tan or like if you go to the beach and you get, a tan, what's happening to your skin then?
It's very good. Why do we get a tan?
I'd say because the cell production would increase because of the energy.
Because the melanocytes, that's what the melanocytes do, right? The melanocytes are supposed to protect, they make melanin to protect you from, they're making more melanin, right? Because that's what they want to do. You see that?
Oh, so they're trying
Do
to
you
protect
see
you
that?
so they produce more. That makes sense.
So when they make more melanin, which means that when we're exposed to the sun, makes sense? When we're exposed to the sun, the melanocytes are more active. Does it make sense? Because they're making more melanin, right? So look at that. So when we cut this, and then we're out in the sun, melanocytes so very active. At the same time that they're very active, the UV rays are damaging them. Very good recipe for mutation. It's just dangerous, okay? So just think, by the way, we don't just get that UV rays from the sun, right? Even the tanning salon. So just be careful, okay? I always remember a student of mine at Pierce College. She approached me after the lecture. She said, "You're talking about skin cancer." She said, "Ever since I was 16, and now she's 22, she was a member of the tanning salon. I guess you have a membership, and she's been going because she likes that color." And she said, I just noticed this one right here. She didn't have that before, like a mole, and now she has it." She said, Should I be worried?" As if it was me, I'd be worried. I would have it checked. Better to be checked than not, right? So what was it? It was. See?
It was.
Yes.
She was only 22.
So at least it's taken out, At least so anything, you just always think there is a reason for the anatomy. In anatomy, you also look at number of layers, etc., etc. Okay? Now, let's look at the other cells. You understand your melanocytes now?
Mm-hmm.
No problem? No problem with this one. Okay? There are two other cells that you find in your epidermis. This one, Langerhans. You write it with capital L like this to remind you that what it does, it eats. See? So this has an immune function. So in your epidermis, you have scattered Langerhans cells. They're like your border patrol because you have bacteria there all the time, and if there's a cut, then there's possibility that the bacteria can just penetrate. We don't want that. So we have our special forces over here. They try to contain the infection. Okay? And then there's nervous tissue. That's why skin is an organ. The Merkel cells for sensation. You have any questions on the epidermis? You see how protective your epidermis is? Okay? So what are you going to tell your friends, your kids? There is a reason for these many layers of epidermis. If we didn't need all that, God would make our skin to be so many layers like that. Okay? Now, let's look at our dermis. You ready for the dermis? Oh, first of all, let's look at these two layers. In addition to the subcutaneous layer, look at how the epidermis and the dermis interlock, like the egg crate. So the way they interlock makes it very hard for the epidermis to fall off. If it was a straight line like that, it's going to be easy for the epidermis to fall off. But because they interlock, at least they're stuck together. Okay? Okay. So now, this dermis, the dermis is not epithelium, of course, it's deeper. By the way, in your final exam, don't forget your tissue terms. So, not tissue terms, your tissue types. So maybe I'll ask you, what is the basic tissue type of the superficial part of the skin? The superficial part is the epidermis. So you're going to write epithelium. The deeper part of the skin is what? It's dermis. So this is connective tissue. Very good. Because it's connective tissue, this is where you'll find, you don't need to worry about these two terms. What I want you to know is, in the dermis is where you'll find your collagen fibers and your elastic fibers. And I remember I already told you what happens if you injure your collagen fibers in your skin. You will have sagging skin. And if you injure your elastic fibers, you're going to have your wrinkles or your stretch marks. You notice the fishermen, right? They're out in the sun always, and then after a while, they will have stretch marks, wrinkles. And the reason, again, if you compromise, sunburn all the time, so they peel. This one gets peeled, so the UV rays is it's much easier to penetrate your dermis. That's what happens. And of the two fibers, this elastic fiber is most prone to UV damage. Okay? That's funny. This one, I never seen this pencil case. The last time I seen that was when I was a child. You know,
I'm used to that kind of things.
I remember, brings back memories of childhood. You ever seen that kind of pencil case?
Use mine.
That's funny. Okay, so you understand? Okay, I'm gonna ask you. So the elastic fibers, you know when you get pregnant, right? And then when you give birth, you have stretch marks. I have stretch marks. So the reason is when you injure the elastic fiber, it's there. It's still there. It's just no longer, no more recoil. So you have the stretch mark. It's distributed, right? It's not because you bought the cheap cocoa butter. They say it's not because of that. It's just that when the elastic fiber gets damaged, that's it. You lost that elasticity in that part of the skin or wherever. Okay? So don't forget these elastic fibers, how it's prone to physical damage. It's just more fragile than collagen. That's why. So it's easier to damage your elastic fibers. So here in your dermis is where you will find your blood supply. So if you ever had like a blister, you know blister, right? You have a cut or no, not cut, but a blister. Can you guess or can you tell me if you have a blister and there's no blood, did it affect the dermis or not? If you had a blister, there's no blood. Was the dermis affected? No, it wasn't. Right? It must just be here between the dermis and epidermis. But as long as there's no blood, I don't think the dermis is affected.
Right, so like those that like yellow fluid,
Plasmas.
is that all the lamellar stuff? Or is that
When you
something
get a
else?
blister and the fluid that's in it, that's not blood, but it's clear.
That's clear.
It looks like
Yeah,
plasma.
that's tissue fluid.
Oh, okay.
So that's just tissue fluid. There's fluid in between the tissues.
Okay.
There's no oil.
From broken cells.
Okay. So because this is dead, right? When we apply, what do you think? Do you remember how when you did your histology already? Do you remember how collagen looks like? Do you remember the tendon and then the areolar connector? You see how big collagen fibers are? They're fairly thick. They're thicker than your elastic. Remember, collagen is thicker, is a thicker fiber, and then the elastic is finer. You remember that one? So, and then the reason why I'm talking about this is because the most common facial cream, you buy the collagen facial cream. Just think, the layer, the stratum corneum is not only one, it's about 25 to 30 layers of dead skin. So you're applying your collagen cream. Do you think that will be absorbed?
No. But isn't that what CoQ10 is for?
Huh?
Isn't that what the CoQ10 is for? So that you can produce it
I
yourself.
just want to know, can dead cells do anything? Can dead cells? No, they cannot.
So what's the purpose of lotion then?
Make you feel soft.
Yes.
But you know what? That's why the skincare companies got us hooked. Because what we're trying to make feel soft today is gone tomorrow. It sheds. So we have to keep applying because we're thinking it's the cream that's working. It's not really, right? It's just, but if you feel good, why not? Just apply. The thing is, just eat properly. See? You see the nourish over here, the nutrition, whatever is circulating in your blood, it's what's going to be nourishing your epidermis. And so if this deeper layer is very healthy, when it rises up, you will have nice skin, right? That's why they now have the holistic medicine. In California, most of the doctors there are doing holistic. They're investigating your diet. And so massaging your skin, a few minutes a day will help encourage circulation. And they say that if you want if you really want to apply skin cream, buy the one that has retinoic acid or isotretinoin, which is a form of vitamin A. It encourages dermal circulation. Just eat properly, and it will show in your skin. Do you agree? Right? Just eat. Protein is very important in our diet. And then massage your skin to make sure that the blood flow is just smooth. Okay? So that's our dermis. You have any questions on the yes?
Does collagen production, doesn't it decrease after childbirth?
Yeah, when as you get old, everything just decreases. Okay, yeah, it just everything just, and also the production of everything is affected also by all kinds of drugs, right? So when you're any kind of prescription medication, maybe they can affect the production of all of these fibers or cells. Okay. Okay. Did you know that when you hit your 20s, you start getting old?
Yeah.
Yeah. But you don't feel it, right?
Nobody feel old
No,
until they
no,
leave this world.
no. But we start getting old. It's just the what do you call that? The cycle of life. That's so. Skin color. Before we go on to our accessory organs, the skin color. What are the factors that lead to or lend to your skin color? I'm thinking, what's the main reason for your skin color? Huh? Melanin, yes, which is in your epidermis, right? So the epidermis, the melanin is the main reason for our skin color. Don't forget, we all have the same number of melanocytes. It's the amount of melanin that is different, right? But we know, you know this term, pallor. What's pallor?
Your skin
Pallor.
like if you're pale or not.
Like grayish, when you have no blood.
When you have, yes, you're pale, no blood supply. So did you say blood? So must be dermis, right? So the dermis is also influencing our skin color, right? Pallor. How about this one? Do you know what this one means? Erythema? Yes, redness in your skin. Blood supply again, right? In the dermis. How about this? You know this? Blue. Blood again. So both the epidermis and the dermis. And then of course everyone knows jaundice. What's jaundice? Yellowish discoloration of the skin. You become yellow because it's from red blood cell, you know that babies. So our red blood cell constantly dies, and when it dies, it gets sent to your liver. The liver processes the pigments. That's why it's called red. It processes the pigments, and it releases the bilirubin. It's called bilirubin pigments. You convert it to urobilin and you PP it out. That's why your PP has that color. And then stercobilin goes to your feces. So the feces has that color. But then when the liver is immature, maybe in premature babies, they're not able to get rid of the pigment. So it stays. So you see the yellow skin. Or people with liver damage or hepatitis, right? The alcoholics, you notice that they turn yellow. Why? That means that their liver is no longer working. So the pigments are not able to leave, it stays. Okay? So you understand these terms? If I ask you to define, you know how to define it. Very easy. Right? Diet can also help. It can also affect skin color. The carrots make you turn yellow. And I found this on the internet actually. There's this girl who wanted to find out if you really will turn yellow, and she did turn yellow. You see that one after 21 days of eating carrots. So the pigments from your carrots can make you turn yellow. Okay? Subcutaneous, don't forget that the subcutaneous layer is not part of the skin. Don't forget that. Because in the test, instead of subcutaneous, what you will see is hypodermis. The skin is made up of the epidermis, dermis, and hypodermis. You will write true. It's false. Even in the comprehensive final exams, don't forget that one. Okay? So now we're going to talk about the accessory structures of the skin. Break first for 5 minutes. Then we talk about the accessory structures of the skin. Okay?